This is a 78-year-old female who presented with about a 2 to 3 year history of back pain on the left side. It never radiated into the leg. It was only on the left side. It's not typically on the right. Every once in a while it radiates to the right side of the back, but it usually stays midline and off to the left side. It doesn't go into the buttocks or the glutes. It doesn't go down the leg. She's undergone a tremendous amount of conservative treatments, which has included physical therapy on and off for 3 years, multiple injections, ablations, and she still has back pain. And so now she presents to the clinic for an evaluation. This is her MRI. So this is the sagittal T2 MRI and this is the axial T2. And so as you can see, she has multi-level degenerative disc disease. If we just look at this disc, this would be a normal disc. And as you can see, she has L1-2. She has a significantly degenerative disc with a broad-based bulge here. Same thing here at L2-3. She has a broad-based bulge here, slight degenerative disc. At the L3-4 level, she has a grade 1 spondylolisthesis where this L3 is shifted forward on this L4 and she has a bulge here. At the L4-5 level, she has a larger bulge / herniation. And then here she also has a bulge at L5-S1 with a slight mild grade 1 spondylolisthesis. So the difficulty here is, we can go through the entirety of her lumbar spine MRI. We can go level by level. We can look at the disc bulging here on the axials. We can see the level of compression. And as we go down, we try to identify what could be causing her the left-sided back pain. Could it be coming from the L3-4 spondylolisthesis? It could. Could it come from the L4-5 disc bulge with the facet disease? Sure, it could. Could it come from the L5-S1 facet disease and bulge? Sure, it could. Could it even come from this L1-2 degenerative disc? Sure, it could. The problem with all this is this does not equate to a situation where I can offer her a procedure that will likely improve the back pain on the left side. It becomes very difficult to say to a patient like this who's really frustrated at her progress that I can't really offer you a procedure that's going to magically improve the back pain. In this situation, what I would say to the patients is, it's been 3 years, physical therapy hasn't worked. Usually physical therapy is good for acute problems or in the post-operative period, but it's not good for chronic long-term problems. Injections, the utility doesn't really work outside of a couple of years if they're not getting long-term relief with each injection. And so in these cases, we would recommend the patient to try some lifestyle modifications. Here I recommended for her either aquatic therapy or aquatic aerobics. I recommended some low-level yoga to try to work on some flexibility. In this case, the provocative testing did not elicit SI joint dysfunction, so we wouldn't recommend any specific SI joint treatments, but we would just recommend hip mobility that can come with different type of yoga and Pilates, anything low impact given her age. But these are the challenging cases for us, and unfortunately, we can't operate on everybody, especially if we really can't have a high degree of suspicion that our surgery is going to help their symptoms.